Hey there guys, I hope you all are safe, sound and most importantly happy. Today I'm here to kickstart my very first video series called the Try Health Learn. Here I'll be dissecting common conditions like back pain, neck pain, their causes, symptoms, bust a few myths along the way and then give you 3 solutions or 3 exercises to mitigate that pain whether you are at any of the 3 levels, say a beginner, intermediate or a professional who has been hitting the gym all his life. So without further ado, let's get started. So today we'll discuss the commonest of the common pains. You guessed it right, low back pain. It's estimated that 70% of us will get one episode of low back pain at least in some point of our lives. It may manifest in various symptoms such as back pain, which may be central or to one side. It may radiate from the buttocks or the back towards the foot. There may be some tingling or numbness in the limbs, or you may have weakness in your limbs. There are various causes that may lead to back pain. One of them is called a disc prolapse, wherein the spongy things in between your vertebra, they move backwards, pressing onto important structures called as nerve roots, giving us pain and symptoms. It may be caused due to degeneration, wherein the sides of the vertebra called the facet may degenerate and cause pain, or it may even be caused by something called as a lumbar canal stenosis, wherein the spinal canal in which your spinal cord is narrows down. However, the commonest cause of low back pain is a back muscle spasm. It happens because you have done something which you are not accustomed to and the muscles can't take them. So that's why you may have low back pain. So let's bust some myths. Myth number 1, MRI is always necessary if you have low back pain. The answer? A big no. MRI does show various anomalies and it may rule out lumbar spine fractures. However, if it shows a degenerative changes, it's just like showing a mirror so that you see the wrinkles on your face. They are a part of the normal aging process. So it does not point to the source of pain, and the source of pain is a complex phenomenon which is mediated by sensors in the back and the brain. Myth number 2, I will definitely need surgery. The answer? No, 90% of low back pain cases are treated conservatively. Only if you have a very dangerous issue such as bowel bladder symptoms, or you have a significant weakness because of a nerve root being pressed upon, only then will you require a decompression surgery. Myth number 3. So I'll have to not bend forward all my life after I have an episode of low back pain? The answer? No. So although bending forward or lifting heavy weights may be painful initially during the acute phase of your condition, as you see your physio and start the exercises, your muscles will gain the necessary control and strength, and you will be able to do anything and everything in the long run. Fear of activity and avoidance of activity help in making small episodes of low back pain into chronic conditions which are very difficult to treat and must be avoided. So now we come to our third and final segment, the exercises part, which will help you to relieve your pain. So the first exercise that I would like to show you is the squat. At the beginner level for the squat, you do what is called as a wall squat. You take the support of the wall so that you don't fall. Your back will be against the wall. Your feet will be 2 feet away from the wall. Your toes will be pointing straight ahead, and slide your back as you go down. Squeeze your glutes or your buttocks while coming up. As you do this, make sure that you look straight ahead and you do not look down, and your head doesn't touch the wall. It's out of the wall. So there you go. You go down. If your hands are in the front, that's allowed, and you come up. All the while keeping your back in touch with the wall. In level 2, that is the second intermediate level, you use a chair behind you, and now instead of the wall, you lean a bit forward from your back, hinging the hip. So what you are doing is essentially the same movement but now with a chair behind you so that your buttock touches the chair and gives you a cue when to go up. So there you go. This is the second level. In the third, that is the pro level or the expert level, you do not use any support. You do a normal squat. However, you go down, increase the depth of the squat. Your hands may be in the front, or you may increase the difficulty by adding a weight under the chin to make it into a goblet squat. You can increase the depth, play around with the depth depending on your pain. If it is too painful, then don't go down too much. So you go down, make sure your knee doesn't go inwards, goes in the same line as the second two. Second exercise, that is the bridge. We are now focusing on the buttock muscle or the gluteus maximus. For this, you have to lie down and keep your knees bent in the way that is shown. For level 1, that is the beginner level, you squeeze your buttocks, press down on your heels and move the buttock portion up without raising the upper chest. Hold for a count of 5 or 10 and then come down slowly with control. For level 2, you repeat what is done in level 1, that is squeezing the buttocks and taking your buttock portion up. But now you straighten one of the knees and you come down with that knee lingering in the air. Do it again for the other side as well. You squeeze the buttocks, straighten the knee and then come down with just one foot contacting the ground. For level 3, one of your knees is straight right from the beginning. Make it straight as possible and then pressing down onto one heel, move your buttock portion up and down. You may hold for a count of 5 or 10. In the third exercise, which is called a dead bug, we replicate the movements of a dying insect. In this, for level 1, that is the beginner level, you start off with the same position as in a bridge, that is lying down on your back with your knees bent. You move your knee towards the hip up to 90 degrees and bring it back down to the original position, alternating between the legs, all the while keeping your tummy tucked in, that is your navel towards your stomach. Do not lose that core. You can also do it by keeping your hands up in the air in front of the shoulder and moving them up towards your head and bringing them back. Alternatively. In level 2, you keep the hand in front of the shoulder, move your legs into a tabletop position at 90 degrees and do a half dead bug by doing a kicking maneuver with the legs alternatively. Straighten those knees and bring it back to the original position, keeping your tummy tucked in. Repeat it 10 times on either legs. In level 3, that is the third professional level, you do it alternatively by moving the right hand and the left leg in opposite directions. Maintain the tucked tummy and all the while keep your core engaged. Do not arch your back too much. I hope you loved the video and found it useful. Please go ahead and do the exercises, and if you have any queries or difficulties, send in me your comments in the comment section below. I'll be coming up with new content every week, so stay tuned for the next video as well. You can even suggest me any condition that you might be suffering from and I'll make a video on it. So until then, stay fit, stay pain free, and do not forget to like, share and subscribe to my channel.